The goal of your surgery is to decrease your pain and improve your symptoms and mobility. Properly preparing for surgery is an important first step in achieving that goal. You need to make a commitment to follow your doctor's instructions both before and after surgery. The following section of this program will show you what you can do now to make your recovery easier and more successful. You must have testing performed before surgery to assess if you are medically healthy enough to tolerate surgery. This pre-admission testing can be scheduled through your family doctor or through the hospital and needs to be completed between 2 and 4 weeks before your surgery. Testing includes a review of your medical history, a physical exam, and blood tests. It may also include a chest X-ray, an EKG, and other testing. This is a good time to bring in a list of your medications with dosages, or just bring the meds in with you in their original bottles for the nurse to review. Be sure to include everything that you're taking. Also, you should let the physician know if you've had any problems with blood clots in your legs or lungs, deep vein thrombosis, pulmonary embolism, or anesthesia. If you fail to schedule your physical and medical clearance is not obtained, your surgery will be canceled. You'll want to bring any advanced directives that you have on the day of surgery. Advanced directives are forms that you complete to provide instructions about your health care at times when you cannot speak for yourself. There are two types. A living will lets you tell healthcare professionals exactly what treatments you do or do not want performed on you in the event that you cannot speak for yourself. A healthcare power of attorney is another type of directive, where you name a specific person to make those decisions for you. You're not required to have advanced directives, but if you do have them, they need to be signed by you and by 2 non-relatives. If you would like to create advanced directives, your nurse can provide you with the appropriate documents. Your stay in the hospital will be relatively short, but your recovery will continue after you're discharged. A successful outcome is heavily dependent upon a quality recovery. You should discuss with your surgeon, your rehabilitation team, and your family the best place for you to recover. Everyone feels more comfortable at home, but sometimes home is not the best place to recover from surgery. Sometimes a rehabilitation facility is a better choice because each patient recovers differently. But even if you and your surgeon plan for you to recover at home, that plan could change while you're in the hospital for several reasons. So you should still check out some rehab facilities now while you're still able to see them yourself. Your pre-admission nurse can provide you with a list of potential facilities. You should check now with your insurance provider to see what your benefits allow and which facilities are on their approved list. Most facilities should accommodate a visit without scheduling it in advance. While visiting, try to see how they operate on a daily basis. Ask to see the type of equipment they use. Also, find out if they specialize in the type of therapy that you will need. Then go ahead and make a tentative reservation for the week of your surgery. You don't have to use the reservation, but it's great to have it just in case. If you're planning to go home after your surgery, the most important thing you can do now is to properly prepare your home. That starts with making arrangements for someone to stay with you for up to 2 weeks. And you should make arrangements now for someone to drive you home from the hospital, drive you to your follow-up doctor's appointment, and, as long as you're on prescription pain medication, to your physical therapy appointments. Check with your surgeon and physical therapist about what equipment you may need after surgery. If you already have equipment that you're comfortable with, bring it with you so that a Mount Carmel therapist can check it out and make sure it's properly set up. And make sure everything you bring has your name on it. Your recovery at home will be easier if you make a few adjustments to your living area before your surgery. You should plan on spending as much time as possible on one floor of your home and limit the use of stairs to once a day. Keep walkways clear of clutter like throw rugs, power cords, or anything that you would normally step over without thinking about it. These items might cause you to trip while recovering from surgery. Do you have pets? Will they be a potential risk for falling? Consider arranging for their care outside of your home until you're steady on your feet. When arranging your living area, try to keep the items you use most often within easy reach. Bring to the first floor any items you may need during the day. You should even bring your bed to the first floor if possible. Sofas and recliners are to be avoided because they do not offer the proper support for your recovery. Straight-back chairs with arm supports are the best seating options during your recovery. Check all handrails and make sure they're secure, and consider installing grab bars in your bathroom. Most patients don't realize beforehand how low a toilet seat is. A raised toilet seat with armrests is very helpful when sitting down and getting up off a toilet. These are available at your local pharmacy or department store. The shower is another potential challenge for you. Consider installing grab bars for stability. Or, if you want to sit down in the shower, just add one of those plastic outdoor chairs. Make sure the chair has non-skid feet or use it on a bath mat to prevent sliding. Consider installing a shower bench for long-term use. It's a good idea to stock up on groceries because your physician will limit your lifting during a recovery, usually to nothing heavier than a gallon of milk. While everyone knows the dangers of smoking, most patients don't know how much smoking can delay and compromise recovery. It's very important to stop smoking. Ideally, you should stop 6 weeks before your surgery. But if that's not possible, stop at least 3 to 5 days before surgery. That's because your lungs need to be clear for the anesthesia to work effectively. Also, smoking constricts blood vessels, which can slow healing and increase the chance of infection and pneumonia. You can decrease these risks by quitting before your surgery. Many helpful resources exist for those who want to quit. You'll find a list of online resources as well as telephone hotlines in the materials you've been given. Check with your surgeon to see if you should eat foods high in iron to build up your blood before and after your surgery. Iron is an important part of your blood. It combines with protein to make hemoglobin, which carries oxygen in the blood to all parts of your body. When hemoglobin is low, you may feel weak and tired. Iron from animal sources is used more easily by the body than iron from plant sources. Eating foods high in vitamin C, together with iron-rich foods, will help your body absorb the iron. A pre-op nurse will call you the business day before your surgery and let you know what time to arrive and also which of your medications to take the morning of surgery. So, what all should you pack? Well, first of all, make sure you have the basic information that will be needed during your stay. And don't forget items of personal comfort and care. As far as clothing goes, remember, you're only going to be here for 2 to 3 days. Pack accordingly. You won't need much. The best clothes are loose-fitting pants or shorts, a knee-length gown or robe or nightshirt if you prefer. And bring a good non-slip comfortable pair of shoes. No sandals or flip-flops. They must not have open toes or open heels because they won't provide enough support and can cause you to lose your balance. Just as important as what to bring is what to leave at home. You will not need any of these items during your stay. Absolutely no jewelry will be allowed during surgery. If you've already been fitted with a back brace, bring it. If you need one, we will order it for you. The day of your surgery is here. Remember, that day starts at midnight, so don't eat or drink anything after midnight. This actually includes gum, candy, and cough drops because they can churn up gaseous liquids in your stomach. It is okay to brush your teeth and rinse without swallowing. You can have a sip of water for any medications that you've been instructed to take. Mount Carmel's policy is that anyone going into surgery should shower with an antibacterial soap the night before and morning of that surgery. If you can't reach your back, have someone scrub it for you. This is very important because good hygiene is the first step toward preventing infection. There are several things that you must not do the morning of your surgery. Don't use any kind of creams or lotions. Don't wear any makeup, deodorant, or cologne. If you wear contacts or glasses, bring them with you so you can read any forms that you may be signing, but you won't wear contacts or glasses into surgery. Your dentures can be worn to the hospital, but will have to come out right before surgery and given to a family member.